This is the part 2 video for Piriformis syndrome. Now we're going to be talking about different chemical stressors, which basically means nutritional stressors that could be causing your piriformis to be chronically tight or weak. My intention for making this video was to help people who have chronic piriformis syndrome and maybe haven't found the answers they're looking for, and they've been stretching and they've been strengthening. This is just another idea to think about that will hopefully help you get over your chronic piriformis syndrome. So, the piriformis, as we discussed, can cause sciatica, which is, tingling, pain, weakness in the leg, and it attaches to here and then onto the femur. So it's an external rotator. The nerve roots of the piriformis are S1 and S2. There's a little bit of overlap with nerves. You have to consider the anatomy of people, like we're not all exactly the same, but that is the general nerve root. That nerve root first controls sex organs in males and females, and if there is any imbalance or inflammation at those organs, or if they're hypersecreting, hyposecreting, then that can actually cause abnormal nerve signaling to the muscles associated. And in applied kinesiology, especially for hormone health, the piriformis is a major muscle that is tested in order to determine if someone is having hormonal imbalances. So a lot of times with women, I'll see estrogen dominance in those women, or really it could be any sort of hormonal imbalance, but a lot of times that's typically what I'll see. So you want to do things that are good for estrogen metabolism. You want to make sure you're having healthy bowel movements, because that helps get rid of excess estrogens and hormones in the body and just helps our body excrete in general. You want to eat cruciferous vegetables, citrus fruits, nuts, seeds, omega-3s, vitamin E is really helpful. There are a few supplements that I like for patients, but I don't want to say to take these, because if you don't actually need this, then I don't want you taking this on your own. So the whole purpose of this video is to give you some other type of idea that you can go run with and hopefully find some answers to your chronic symptoms. So maybe go get your hormone levels checked, and then work with someone to properly guide you on what type of supplemental support you need. But that's why, offhand, totally safe to say this to you guys: take vitamin, you can consume more foods with vitamin E, have more vegetables, do things to help your liver detox better, and that should help your piriformis hopefully clear up, especially if it's chronic. Another thing to consider is if you have hypersecretion of cortisol, because that will actually inhibit your body's own ability to make other hormones efficiently and sufficiently, like enough to where you actually can function well. So I see this a lot in athletes who push themselves really hard, or anyone with a lot of mental stress, which is a lot of us. So when you have too much cortisol being secreted, which is our stress hormone that gets us ready, it's our fight or flight hormone, your adrenal glands secrete that. And if you look at a hormone pathway, you start with cholesterol, which, fats, and then you go to something called pregnenolone, and then you go down other pathways to make cortisol eventually, or like estrogen, progesterone, etc. So if your body requires more cortisol, then because cortisol is so important for us to stay alive, it helps our heart pump faster, it brings up our blood sugar levels to be shunted to our muscles so that we can run away from something. That hormone takes priority, And so if you are someone who is requiring a lot of cortisol based on your daily habits, like you're over-exercising, and I mean like really over-exercising, I don't mean just regular exercise, or you have a lot of mental stress, or you had some trauma happen to you, or maybe you have some underlying infection and you have a lot of cortisol being secreted, then that can actually inhibit your body's ability to create these other hormones, causing hormone imbalance. So it's a lot of information, but if you are someone that is chronically dealing with piriformis syndrome, and like I said, you've been stretching, you've been strengthening, this is another thing to consider, and it's something that I actually see quite often as the reason for someone having piriformis syndrome. I hope that helps. If you have questions, please comment below, and happy healing.